right. Hey guys. I see already on. Great. Thanks for joining. Those of you who are on so far. Hey. Hi.
Hey, how's it going?
Thank you so much for being on time.
Oh, no problem. I
It's
was
a
like,
nightmare when I just sit here reading names for like 10 minutes.
I'm sorry.
It's the part I dread most, so I'm glad we didn't have to do that tonight.
Oh yeah, you did not have to do that. I'm a very on time person.
Good. Well, we'll just start right away and people will join and watch later. So, let's see. So why don't you tell us a little bit about your background and your connection to mental health, and then we could kind of get started in conversation.
Sure, sounds good. Hopefully I don't sound too sick. I just came back from vacation, so we're all sick. My baby's sick. I'm
Oh
sick.
no.
Hopefully she doesn't wake up. She's sleeping. But okay, so let me get started. My name is Eliana. Nice to meet you all. I'm from Toronto, Ontario, in Canada. I am a registered nurse. I think it's like the same schooling there is in the United States, so I don't think it's anything super special. But I was always very passionate about um, helping people and getting to know people kind of one-on-one. I wasn't entirely sure what I wanted to do, but when I found out about nursing and kind of just like the broad thing that nurses do, I kind of found a niche in OB, obstetrics. Um, and I never really knew how much mental health was intertwined with obstetrics. It was honestly a little bit shocking to me when I got my first job. I worked on a high risk obstetrics unit, which is essentially a unit where um, I was working with women. I guess we took women from 12 or 13 weeks on. So after the first trimester, um, who are experiencing any obstetrical issue. Typically, it was physically involved, like a bleed or something was wrong with the baby, shortened cervix. The list goes on and on and on. But essentially, it was pretty shocking to me when I realized that working on that unit was that my coworkers essentially said to me, welcome to the mental health unit for pregnant women. And I was like, what? Like, I remember doing my mental health clinical rotation in nursing school, and it was a little bit terrifying for me. I'm a pretty emotional, not such a strong like character, and like the nurses who work there were like amazing, top-notch people, and I was like this little girl, like little from girl in the background, like oh my God, like I'm scared somebody's gonna like jump on me, and I don't know what I'm gonna do, and I like didn't realize what I was getting myself into essentially when I went into obstetrics. And I became super passionate about mental health and mental health advocacy through my experience working in OB, especially with high risk pregnancies, which is a huge risk factor for mental health in pregnancies and postpartum as well. Um, and then I got a full-time position on a postpartum unit in the same hospital. So it's a high risk obstetric hospital. So we're seeing all the same patients who have gone through an insane pregnancy and now they have their baby. And hopefully my baby's not waking up. She's just
Okay,
tossing and
we're
turning.
baby friendly here. Half the time I like my babies are on the screen for half.
That's awesome. Um, and then I learned a lot about postpartum depression, postpartum mental health disorders, mental health issues. We do a lot of teaching with regards to postpartum mental health, especially with the fathers, which I want to get to. Also, this was also another passionate topic of mine because when I did work in high risk, that was another thing that was very shocking to me, how much it affects the father, and how many fathers kind of go unnoticed with regards to their mental health while their wives are pregnant, and while their wives are postpartum. I did a lot of research and unfortunately, I haven't even come up with a ton because, while I was working, because it's so new, it's such a new field. And yeah, so that's essentially like my background. So yeah.
Okay, great. Thanks. Thanks for sharing. So I don't have in general like a list of questions. I guess as things come, I try to think of it. But if anybody who's watching does have questions as we go along, please ask and we'll just address them as they come. But it sounds like a avenue we should go down is the fathers and the husbands. So yeah, I mean, that's definitely something that I personally haven't heard much about. So,
Sure.
and I'm sure like people would want to be interested in that too.
Sure. Okay, so let's start there. Um, so fathers slash men, we'll start with pregnancy. Um, I remember one of my first experiences on the unit. I had a patient whose baby, I'm trying to remember what the baby had. I think the mother had a short cervix and the baby was being threatened to be delivered early. So the mom was, I think, 24, 25 weeks. And I just remember the husband like yelling at the wife, being like, "We just need to abort the baby. Let's just abort the baby." We have a rule in our hospital that it's actually Mount Sinai, so it's like a Jewish hospital. So we actually do therapeutic abortions on our unit for genetic issues. Not for social issues. So like if it's a boy versus a girl. So it's not really an option, but essentially they do allow a therapeutic abortion for a baby up until 26 weeks. And after that, they don't allow it anymore for purposes that the baby will be able to survive and it's a viable baby. Obviously, it's viable before, but that's essentially the law in the hospital.
Mm-hmm.
So I just remember it was really like a little bit traumatizing for me. Like I had to document this whole thing, like husband yelling at wife, like it was like a whole to do. And I just remember speaking to the team leader that night, and she told me, like we find like a lot of the husbands get like overly, like this is their baby, and like this man doesn't want to have, he understands the risk factors of having a 25 weeker. Obviously today's day and age medicine it's pretty good. Even 20 years ago, I know of lots of miracle babies who were born at 24 or 25 weeks who are thriving today. But unfortunately, we usually only hear about the good stories and we don't always hear about the bad stories. And there is a lot of research that shows that the earlier the baby is born, the more issues they tend to have and the more chronic issues they tend to have as they get older. And this father did a lot of research and he was like, you can go into labor anytime and deliver this baby anytime, and we're gonna have a special needs baby and the baby's gonna have tons of issues. And he was like yelling at her, and like I was just this little new nurse like standing in the corner like, oh my God, I don't know what to do here. And I went home and I did a lot of research because I was like, what is going on with this husband? Like, why is he like so full, like he was like passionate about it. He was like, I want a healthy baby, like whatever. And we discussed, like me and the nurse manager, not the nurse manager, the team leader on the floor, we discussed, she said, like more and more we're finding that the husbands particularly are having a really difficult time. Like, and we didn't even really notice it before because they're not our patients. Like our patients
Yeah.
are the women. And like we offer a ton of emotional support. Like every woman is seen by a social worker on that floor. Every woman, you know, you don't have to come in diagnosed with schizophrenia or bipolar, anxiety or depression to be considered a mental health patient on that unit. You're considered a mental health patient on that unit. Like
Mhm.
there's so much anxiety, there's so much going through these women's minds, and um, so it was kind of like shocking to me when she said that because she was like, we don't have any support system for the husbands here. Like like they're not our patients. And in Canada, at least, it's socialized medicine. Like we're not offering our services to the men, we're offering our services to the women. And it just like it was really shocking to me. It was kind of difficult to me because again, I'm like this emotional person. I just want to like hug everyone. I want to make everybody feel better. I was just like, I didn't know what to do. And this case was like, it was an insane case. Like it went to the ethics board. Like they wanted to abort the baby. I don't even remember what happens in the end, but
Oh man.
uh, what'd you say?
I said, oh man, we're not gonna hear the ending.
I know. Actually, I don't think they aborted the baby in the end. I think they kept the baby. And I think she made it one more week. Like, I think the baby made it to like 26 and a half weeks, which was amazing. The unfortunate thing is, I don't know what happened to that baby. I prayed for that baby like every day. I was like, please don't be special needs, like for this family. Like, but we don't know. But, anyways, I started doing a lot of research. And again, I didn't come up with any definitive answers. I mean, I know that's honestly a lot. And oftentimes in mental health, we don't come up with definitive answers. You know, there's so many different types of medications, and some work for some people, some don't. Um, some have more interactions with, you know, the body or with other medications, some don't. And it was very, very similar with men and pregnancy and mental health. One of the things, though, that I did come upon is that they are doing more research. They are doing studies now. So hopefully in a few years, we'll have some more conclusive evidence. They don't have it linked to any particular hormones. What they say is the cause is, you know, the man is typically, you know, we're going to be like gender specific right now. I know it's a gender friendly world, but typically in a gender specific world, a man, you know, takes care of the finances. They're the breadwinner, they're the whatever. And I know in this specific case, the one that I was just talking about, you know, this man was like freaking out. He said, we're going to have to send our kids to a special needs school, and it's going to be a lot financially. It's going to be a big financial burden. And that's one of the biggest risk factors for a man. That puts them at the biggest risk for like a depression or anxiety during pregnancy and postpartum for their partner. Um, it's typically it'll typically have to do with, you know, their responsibility as a father, as a spouse, you know, coming into their new role as a father, the anxiety that they might be feeling. But unfortunately, they haven't really linked it yet to like hormones. Like they've done a lot more research on postpartum depression, where, you know, they've linked it to a drop in hormones after, you know, the woman delivers, a drop in progesterone, estrogen. But for men, they haven't really done that yet. So there's still a lot of research going on there. But yeah, basically it's the same signs and symptoms you'd find in general depression or anxiety. You know, a lack of interest in their daily activities. You know, especially particularly with the pregnancy, a lack of bonding with their pregnant wife, a lack of bonding with their future baby or with their actual baby, depending on if it's prenatal or postpartum. You know, they might withdraw from friends and family. They might feel very, you know, into themselves, suicidal thoughts of harming the baby. So all of these are used to diagnose. But yeah.
I was thinking when you were saying the hormonal part of it, I mean, what kind of relationship could they draw for that?
Right. No, you're 100% right. I think they're probably looking maybe at blood markers or stress markers. I guess obviously it's probably not hormone related. I guess the reason why I said that is just because a lot of pregnancy in women related is hormone related.
Right.
So
Okay. Right. So I would think it is very heavily situation based. Maybe I don't know.
yeah, no, it really is, and that's essentially all the research that they have now. But it's very real. There are I don't like to give statistics, but the statistics that I found, at least most recently, is between 2 and 25%, which is big, like
Mm-hmm.
it's a gap, which just shows you how little research is done, unfortunately. And
Yeah.
one of the reasons I think is also underreporting. I think that people don't always realize that they are going through this, especially the men. Women sometimes might realize it more because they'll say, okay, like something's off here. Sometimes women are more in tune with their bodies than men. Men also might say, oh, like, why would I be experiencing postpartum depression? I'm not pregnant.
Right.
Perinatal depression, like, I'm not going through anything. When really they're going through a lot. So um, they need just as much support
Yeah.
as women do.
I wonder since you're in the unit that you're in involves people with physical illness and like, issues with their physical issues with their pregnancy. I wonder if that is a higher risk for mental illness.
Yeah, 100%.
Yeah.
Yeah.
So
Um,
yeah, so maybe even like for men, if we're talking about men specifically, then it is like another thing you're stressed about or anxious about or whatever, something like you can't you don't, it's out of your control, basically, all these things that are happening to your wife.
100%. And that's like, I find for a lot of the women also on the unit, it's everything's out of their control. Um, there's not really, in a lot of these high risk situations, you can't control when you go into labor. You can't control, you know, the length of your cervix, how long you can hold the pregnancy, if you can hold the pregnancy, if the baby has a genetic issue, those kind of things.
Mm.
It's very difficult for them, and yeah, it's a real problem. And I actually titled the this chat that it's not always happy, because I think that like a lot of people, a lot of my friends were young girls having our babies. People just expect things to go smoothly. They expect to like have that pregnancy glow. They go on Instagram, they see all these people all dressed up in these flowy dresses, having photo shoots. It's all like beautiful, and people don't realize that it comes with a lot of anxiety. It comes with a lot of and people suffer silently. It's quite underreported, and actually, postpartum perinatal depression is the most underdiagnosed obstetrical issue, which is really sad.
Mm-hmm.
Um, it's unfortunate that more people aren't being treated, and yeah, it's also new research shows that taking a lot of anxiety, anti-anxiety and antidepressants, a lot of SSRIs, they're actually safe to take in pregnancy. Obviously, you have to ask your doctor specifically the one that you're on, but a lot of people, that was also something that, they just recently in the past few years realized is safe for them to take. And it's great because people who do suffer from anxiety and depression, even before they're pregnant, can, you know, still have a good pregnancy and still be treated for their mental health issue.
Hmm. I know for me, when I went through my stuff after I had a baby, I was open about it on social media, and like tons of people messaged me. I mean, and text, like random people, friends messaged me like, oh yeah, my friend had this. Oh yeah, I had this, blah, blah, blah. Like I didn't expect that. I was doing it for other people to feel comfortable, with their stories and all that. But like, it was just so interesting to hear that pretty much like, and not everyone, but whatever, a lot of people are affected by
100%.
something.
And for you for sharing your story. That's awesome. I actually also shared my story on my page. Maybe I'll share a little bit now just because it's quite related. So when I was pregnant, my baby's actually like crying. It's fine. She'll put herself back to sleep. When I was pregnant, so this was last year around this time, I actually had, unexpectedly, I had to have gallbladder surgery when I was 12 weeks pregnant. It was emergency surgery. And I remember the first thing that in my story is that we were sitting in the emergency room. I was just expecting to get some pain meds. I was in a lot of pain, and they were like, oh, you need to have surgery right now. Like, your gallbladder it's filled with stones and whatever. You need to have surgery. It's going to be infected. It's going to explode. There are going to be issues, whatever going on. I couldn't even hear. I was like, surgery? I'm pregnant. This doesn't make sense. They're like, yeah, and you might lose your baby. Like, you're having surgery. And I was like when I was freaking out, it was like, like when I go back, I just wonder like how I got through that. We were crying, people were giving us tissues. It was traumatizing. Thank God we went through with the surgery. My baby did very well. Thank God. I am a nurse, so I work shift work. I couldn't go back to work for 6 weeks. So I was off and I was like, I need to get back to work. I'm like just going crazy, whatever. By the time I got back, I think I was around 18 or 19 weeks. Get back to work, start doing work. Within a few shifts, I started having these weird stomach pains. I'd never been pregnant before, so I didn't know that I was having contractions. So I went to the labor and delivery triage. They told me I was having contractions. They're like, you need to lie down, you need to like take it easy, drink, whatever, because you don't want to have your baby right now. I think I was 19 or 20 weeks. It was traumatizing also because I had experienced that as a nurse, treating patients, but I never as a person.
You've seen it go wrong.
Yeah, like literally. I'd seen it go wrong. As in my time on the high risk unit, I unfortunately was part of a lot of loss, pregnancy loss, and intrauterine fetal demise. I delivered, unfortunately, a lot of stillborn babies way too early, and I was like haunted because I'd seen this in real life. So that was also very traumatizing for me. I knew way too much. But anyways, I was like determined to go back to work. I went to my OB. I'm like, I need to go back to work. She's like, fine, I'm giving you one more chance. If this happens again, you're off work. So I went back to work, and it happened again. Not surprisingly, she told me that my
feet all day, like.
Yeah, I was working 12-hour shifts,
Right.
night shifts. And they don't know if it was like a complication of the surgery, like if just my body wasn't fully healed. They're not sure. But essentially they were like, you're off. My OB was like, you're off work. So I was 20 or 21 weeks at that point. And so I was off work until I delivered. And in the meantime, it wasn't like things were like not complicated. I was still having contractions. I was on bed rest. I had a lot of appointments. I had a lot of ultrasounds. She had initially told me that my cervix was shortening because I was having contractions. She's like, you're like going into labor, which was very traumatizing. But thank God bed rest was successful. I made it at first to 34 weeks. And at 34 weeks, it got really bad. I went to the hospital. They gave me the steroids to develop the baby's lungs. She, thank God, decided not to come, but it was a really traumatizing 5 days that we were there. And then at 38 weeks, I went into real labor. It was also, I didn't know, I was always like kind of having contractions, always kind of in like this, am I in labor? Am I not in labor? But I was in labor. I got my epidural. Labor was great. Thank God. It didn't last too long. I get to the pushing part. It maybe lasted 10 minutes, 15 minutes because her head was tilted, so it was stuck. So every time I pushed, her heart rate dropped. And again, with all my experience, I like knew what was happening. I knew that it wasn't good. I could hear the heart rate dipping in the background. I was like, something's off. They tried doing forceps. They tried using all these different equipment.
This story's even more dramatic with the baby crying in the background.
Oh, can you hear her screaming?
I just heard it for a second when you're like talking about like her head being tilted.
um, you're so funny. So they ended up, they had to do an episiotomy. They had to use forceps. It was pretty traumatizing. They stitched me up. They gave me my baby. It was amazing. She came out screaming. We were really lucky. They were expecting a blue baby. They were like, this baby is going to need to go to the NICU. She came out screaming. I thought the drama was over. I'm like, the drama's over. It wasn't over. 5 days later, I had an infection in my stitches.
Oh no.
So I had to go to the hospital and have it cleaned out, and they didn't want to re-stitch it. So I had a gaping open wound. I needed to go to the hospital every day for the first 2 weeks of my baby's life. I was in excruciating pain with no relief. And I had what they called postpartum depression that was undiagnosed. I diagnosed myself as a nurse. I didn't want to post her on social media. I didn't want people to come see her. I didn't want to see my friends. I kind of just removed myself from the world because all my expectations of what I thought postpartum to be and what I saw on social media, what I saw my friends going through and what I saw my patients going through, forget about all my friends. I was like, I am a postpartum nurse. I'm a OB nurse. This should not be happening to me. I couldn't walk. I couldn't sit. I couldn't lie down. I couldn't do anything. It was really traumatizing. It was hard. I cried. I was just not myself at all. It was a really, really difficult time. And I spoke to my doctor. I saw my doctor every day for the first few weeks. And after that, it started getting a little bit, okay, every 2 days, every week, every 2 weeks. It was really hard. And again, like as a healthcare professional who's seen this, I didn't know how to like not treat myself, but I didn't really know how to like deal with it. I knew that thank God, I was already surrounded by a really good support system. I had my parents and my husband, my sisters, family members who I was really close with, but that was it. That was like my circle of people. People are reaching out, oh, can we bring you meals? Can we bring you this? Like, I just like didn't respond to people. I like couldn't go on social media anymore. I couldn't I couldn't even be happy. Like I couldn't take care of my baby. Like my husband, thank God, was able to stay home. Sorry, the first few weeks. And he claims he was Gabby's mom for the first few weeks, which he was. So he got to bond with her in a really special way, but I couldn't breastfeed. I literally couldn't sit. It was really hard. But again, I thank God I had an amazing, amazing support system. I think that was my number one. And that is one of the number one things that we tell our postpartum ladies and when I was working on high risk, also we say our number one, surround yourself by somebody or one or two people at least who you can rely on, who you can call up if you're ever experiencing, thoughts of feeling really sad and really down, and somebody who you can talk to. Oh my gosh, she's so upset.
You could bring her out here.
No, it's okay. She needs to go back to sleep. She's trained. She'll put herself back to sleep. She's like a little bit jet lagged from our trip, but it's okay. Yeah. So I did have a social worker who I was seeing. She was amazing, and I did have my support system. And my dad actually was the first person to tell me I couldn't sit down. He was like, we're gonna get you to sit down again. You're gonna relearn how to sit. And he's a chiropractor, so he's like, we're gonna sit for 1 second. He's like, just sit for 1 second. So I sat for 1 second, and I was able to sit for 2. He's like, look at that, you were able to sit for 2. I honestly felt a little bit like a toddler. But sometimes when you're experiencing things like this, it's good to take a step back and realize that help is okay, and getting help is okay, and seeking help is okay, and that you can't always take care of yourself, and it's that's okay. As a nurse, that's hard. That's like a hard
Right.
thing. I'm very used to taking care of other people and not taking care of myself. It was a good lesson. Um, but kind of experiencing that and experiencing like those symptoms in real life um, was pretty eye-opening to me because I've always been compassionate and empathetic to my patients who are experiencing those kinds of things. But like really actually feeling what it feels like to not want to talk to your friends and to not want to be part of society and to not, to be so sad that, like, why am I experiencing this and why is everybody else taking their babies for walks? It's June. Why can't I walk? Why can't I sit? I had my baby in May, but like it was the summertime. Like why am I not wanting to go out and enjoy, So I think that was I wish I didn't experience it, but I think it was it was good to experience it because now I feel even more empathetic than I did before, because I actually know how isolating it feels when like you just can't even control it. Like your mind honestly like takes over. And I wasn't like my doctor didn't diagnose me with anything. She said, no, you're seeing a social worker, you have a good support system. I had all the things in place, like, textbook wise. I was living at my parents' house. I had a supportive husband, a healthy baby. I was getting treatment. I wasn't taking any antidepressants, but I seemed to be doing okay. But in reality, like, am I going to be a statistic in a textbook? Probably not. Like, she didn't sit down and say, you know what, you probably have postpartum depression. Here's what we're going to do. It was more like, okay, like you're on a good route. So that was also interesting for me, just to like kind of, like I told her all my symptoms. She's an amazing doctor, but like it's interesting. It was interesting for me to kind of experience it from the other end. Um, and yeah, it's I think also I was talking about this with my sister today. I think social media, especially in today's day and age, adds a big I'm trying to think of the word. I'm having mom brain. Like problem. I don't know, like not problem, but like kind of like a facade because people present themselves in a way that's beautiful and
Yeah.
everything looks good and you sign on and you're like, oh, why isn't it good for me too? Um, I think that was kind of hard. Um,
Yeah, I feel like that's a theme. I feel like that comes up a lot in almost every topic.
I'm not surprised. The word is lie. Yes, the word is lie. Social media is it's often a lie. Sometimes it's real. This is real. So
Well, you're just seeing the best. It's not necessarily, I mean, sometimes it's a lie, but you're also just seeing the best, like, of that person's day or week or
yeah,
year or whatever. So, like, they're just showing you what they want you to see.
yeah,
They don't need
100%,
to show you the bad parts.
100%. Um, so yeah, that's my story. I mean, there's a million stories out there, and like you shared your story. I think sharing stories makes it a little bit more, um, especially on social media, makes it more real. It makes people who are going through it say, "Oh, other people suffer too. Other people are going through it too. Like I'm not the only one going through it." Actually, I was recently at my OB's office, and I told her I was like, if anybody else ever experiences something like this, because I was so isolated, like nobody else I knew had gone through something like this. After having a pregnancy, forget about the pregnancy, like that was on its own like a whole a whole problem. But nobody's ever experienced something like this. Please tell those people to call me so they don't feel like they're so alone. And she was like, wow, it's so nice. And I'm like, it's not nice. Like, it's just like, like, I just don't want them to feel like they're alone. Hey, somebody said everyone has a story. Everyone has a story, like even the person who had like a really easy pregnancy and a really easy postpartum, maybe their baby is a very difficult baby. Maybe they don't have a good support system. Maybe they don't have all those things in place. And You know, mental health comes up everywhere. It doesn't have to be postpartum depression can last for years. It can last for, and it can start, it doesn't have to start a few days after the baby's born. Something that also people don't know, it could start a few months into after the baby's born. That's also not necessarily a hormonal relationship, but it could be a situational relationship. You know, having a difficult baby, having a lack of support, lack of sleep. There's a lot of issues. There's a lot of risk factors. Um, yeah, everybody has a story, and I think sharing it is important, to not only spread awareness, but to also help people realize that this is a normal thing and this is what people go through, and talking about it is healthy. It helps to heal. It helps to process. I need to take a drink. I talk a lot. Sorry, that's like my.
I like the talkers. I like to listen.
To listen to. I feel bad. I tend to talk a lot. But yeah. Anyways, now you talk. Do you have any questions or any comments?
Well, I like the comment that someone said that spreading awareness is really important.
Yeah.
I definitely believe in that. Something that I was thinking about while you were talking that kept coming up in different ways in my mind is, is the place that you work, is it Jewish?
Okay. That's a touchy topic.
Oh.
It's not. I mean, Mount Sinai in Toronto was started because Jewish doctors, I think it was started in the 20s, maybe 1920s, 1930s, because Jewish doctors were not allowed to work in regular hospitals, so they opened up their own hospital. So it started off as a Jewish hospital. Essentially, all the donors are probably Jewish, but the I don't know if like the values are still Jewish,
Mm-hmm.
like with relation, especially to like therapeutic abortions, to the
Right.
food served. You know, there are like certain things that kind of come back. I mean, I don't know if they're like situated in like Jewish law, but like, and like halacha, but they are Jewish. There is a lot of Jewish related things. As a nurse, it was difficult to be accommodated for my for Shabbos. That was a whole different story, but there aren't a lot of Jewish nurses, or at least Orthodox Jewish nurses. So that's topic for a different time. But yeah, it did start off as a Jewish hospital, but it's not. Yeah.
Well, I mean, I guess I was just thinking about how Judaism kind of might play as a factor, because I could see it on both sides, like being a protective factor, and on the other side too, like, meaning it's almost like, I don't know. I've had this conversation before with friends about how, like, it's almost like, you know, where we can handle, you know, babies, we can handle this, we can handle that, like, we're, you know, it's built into our culture. And then there's the other side where it's like, you know, like high expectations to bounce back and be, you know, on your feet again, a lot of comparisons in a small community, like all that. So I feel like there's the two sides. I don't know. I wonder, do you see any, like, have you noticed anything one side or the other? I mean, I don't know about your patients if they're even Jewish, but I'm curious to hear, even from the comments, like, if people who have had children, like, have felt that there's any kind of like mental illness related to having kids, if there's kind of any relation to being Jewish. I don't know.
Definitely. Actually, now that you talk about it, I think you can tell me if I'm like going off topic right now. Just stop me in my tracks.
I mean, if people don't want to watch, they could just leave. So
that's true. I think that, so we don't get, there are like a lot of hospitals in Toronto. This one happens to be downtown, which is not where the Jewish community is situated. So there are a lot of Jewish people and Orthodox people that do go there, but they do tend to go to the ones that are closer, which I don't work there. But I think generally, you're right. I think there's a lot of expectation on young Jewish women to have babies, to, you know, have lots of children, start young. Maybe they're not so advanced into their marriage. There could be a lot of factors that go into that mental health aspect just on that end, you know, being young, you know, not being in necessarily a relationship they've been in for a long time, not necessarily having a lot of life experience. Yeah. And essentially, I think that it does play a big role. I think especially, you know, if they're not pregnant right away, or if, you know, it's been a few years and they haven't had a baby, that's a big topic. My
Yeah.
friends and I talk about a lot, you know, getting comments, going to, you know, weddings and saying, oh, like, don't you want
Yeah.
kids? What's going on? And, you know, not realizing that like a lot more goes into having babies. You know, some people struggle, some people are not there financially, for whatever reason it is.
There's a great account called, I think, I Was Supposed to Have a Baby or something.
Yeah. Oh, I love her page.
I
She's
think
awesome.
she does a really good job highlighting some of the struggles.
She's really, really amazing. I've spoken to her a bunch of times. We have really good conversations. We have a lot in common, just with regards to our medical backgrounds. She's a pediatrician by practice, and yeah, she has a great page. I Was Supposed to Have a Baby. You should go check her out, guys. But yeah, it's a real problem. I think particularly, you're right, in the Orthodox community, just because of all those pressures. And it's interesting. I remember when I was actually a counselor in a special needs camp, we had a young, I think they were like a Hasidic couple, like probably 19 or 20, really young, and they had a special needs baby. It was their first baby, and they were coming to the special needs camp. And I remember like being so shocked. Like I was young and like I was super mature. Like I was probably like 18 or 19. I was like, oh my God, like they're 19, they're my age and they have a special needs baby. Like, how is this possible? Like I couldn't even like comprehend. Like I was just like, how did this happen? Like obviously then I grew up and I was like, of course, like anything's possible. Like it's unfortunate, and you know everybody wants to have healthy children, but this is the reality of the world. And yeah, there's a lot of pressure and there's a lot of unknowns. And I think a lot of people, I think another thing with regards, especially to mental health during pregnancy, a lot of people expect their pregnancies to go well because they're not necessarily educated. They don't necessarily know what can go wrong. And a lot of people talk about their pregnancies as if it's like nothing, almost. Like they're just like, oh, like, of course it's going to be fine. Like, of course my baby's going to be healthy. Of course, like, the baby's going to come on time. And then, like, sometimes something bad happens and they're like, what? Like, how come nobody told me? How come, like, all my friends, like, who got married with me at, like, 21 all have a healthy baby, and, like, my baby's in the NICU and I delivered at 27 weeks and I had a bleed and I have whatever and my blood pressure was skyrocketing and list, you know, the list goes on and people aren't educated. It's actually one of the reasons I started my page, because I just feel like so many people aren't educated. Like people know, but then so many people just don't know. And like, it's scary. Like, you know, it's our bodies, like as women, like, and especially like, you know, being a from Jewish nurse, like something like I've always experienced in my community is like, you know, I'll go to a Shabbos meal and I'll be sitting with girls, and like the way that they talk about like getting pregnant and just like everything was so easy. And I'm just like, oh my gosh, like they don't even realize like that I just came home from like delivering a stillborn baby. Like they don't realize that like these things happen. Like it's like, it's upsetting, and like it's hard, and like people's expectations make these mental health issues so much more prevalent, and then nobody wants to talk about it because they're like, oh, they don't want to talk about it. Especially I think in our community, nobody wants to talk about it because they're like, you know, fertility, that's a whole different topic that nobody talks about. Like it's unfortunate. Like we should talk about it because so many people are going through it and so many people are suffering silently,
Mm-hmm.
and not including them. You know, I can rant about this for hours.
Yeah. Well, I have seen some infertility stuff throughout social media lately, like the past few months. I don't remember the account.
No, yeah, no. Even there is, and the truth is, you know, as I've started to explore Instagram a lot more. I've seen it also a lot, which is good. And getting the conversation going is good. But I think that we as a community can do better. I think
Yeah.
pages like this are amazing. I think raising awareness in any way that we can is amazing. Kudos to you. um, but yeah, I think that we have a lot of work to do, and it's definitely, our work is not over. And you know, making people feel like that they can talk about these things openly and not feel like, oh, everybody's just looking at my stomach and expecting me to be pregnant and expecting me to come home with a healthy baby on time. Everything's good. Everything's dandy. Like realizing, you know, educating our girls, you know, in high school or seminary, whenever you want to educate them, like, you know, pregnancy doesn't come so easily for everyone, and there could be issues, and this is what you should do if you ever have issues, you know, if you ever experience these symptoms, if you know, talking about like mental health, and you know, getting our educators to make it more a topic that, like, so people don't feel so isolated, you know, so that it's just a normal thing that, like, oh, like, you know, when you're 20 years old and when you're experiencing a pregnancy complication, you're not sitting at home by yourself and crying and going into a rut and unfortunately going into depression, and who knows what that will lead to. Like, it will say, oh, I remember my college teacher told me,
Right.
I remember learning in high school in my science class, oh, I remember learning whatever. And I think this is important for every community. I think, you know, just as much I think it's important to like teach us how to do taxes in high school, because I don't know how to do taxes now. Like like I think that learning real life issues is important, and maybe starting at the root of the cause is not the root of the cause, sorry, the root, which I guess is like teaching them in teenagehood and young adulthood, you know, these are things that happen to people. You know, now you're mature enough to know, you know, you're going to be pregnant hopefully in a few years, you want kids, you want to get married. These are things that you should be aware of. You know, your friends might be struggling with. So maybe when you're at a wedding, you know, don't sit there and complain about how difficult it is for you to have swollen ankles and how you can't make, you know, steaks for your husband because you can't stand on your feet anymore because you're so tired, and because your friend next to you might be experiencing infertility and she might have been trying for a few years, and she's looking at you like, wow, you're so blessed, and meanwhile you're like, oh, my life sucks. Which, okay, granted, like, your life probably does suck, but put it into relativity and realize who you're talking to and realize what you're doing. And everybody has a time and place to complain, but I think yeah.
We had a few questions. I don't want it was good. It was a good ramble, but I don't want to miss out.
Sorry, I really
No, I like it. This Rebecca says, wondering if we discussed shame relating to nursing and how it contributes to postpartum issues.
Oh, yeah, definitely. It happens to be, I think today, she's talking about breastfeeding, right?
Uh,
I think so, right?
That's how I interpreted it.
Okay. I'm gonna interpret it like that. You can tell me
Yeah.
if I'm wrong. Because like people also call it nursing. Okay. With regards to breastfeeding, I think that today that topic, a lot more people are realizing that fed is best. I think that quote came out a few years ago, and I think that a lot more people are recognizing that that's actually a the right thing to do, and shaming people for not breastfeeding is the wrong thing to do. However, I do think that there is still some stigma almost attached to people who either choose to formula feed or can't breastfeed for whatever reason. And yes, I definitely think there is it is a risk factor for mental illness or depression, anxiety, especially depression. We see people coming back to our, we have an ambulatory clinic. It's called the postnatal ambulatory clinic. And there's people coming back, and, you know, we talk about there's postpartum blues versus postpartum depression, where postpartum blues, you know, are the normal is the normal postpartum depression. Everybody kind of experiences it after they have a baby. It's where, you know, you're teary and
I
you're just
remember that.
hormonal. You're like, oh, you're tired. You haven't slept in like a week, and like that it lasts for a couple of days, and then you're kind of like, okay, I've got this thing kind of figured out. You know, for the people who are having trouble with breastfeeding, especially in the first few days, baby's not latching, milk's not coming in, they're having problems with their milk supply, they had expectations of breastfeeding, it's 100% a risk factor. We see people coming back who definitely have deeper issues, deeper symptoms, deeper problems than just that surface, you know, I'm tired, I'm sad, I cry sometimes, and I'm happy, and you know, your moods, you kind of have mood swings, but it kind of tapers off. You see them feeling shame. You see them feeling like I'm doing something wrong. I'm not feeding my baby properly. And I think that just goes along with any postpartum expectation that, you know, for example, like in my story, where I expected to be amazing on day 3, and I expected to be able to take my baby out on walks, and I expected to like whatever. And I, you know, when your expectations don't meet your reality, that's where, you know, do you have the coping mechanisms? You know this, the whole mental illness train, you know, you don't have the coping mechanisms, your expectations didn't meet reality. Now I feel stressed. Now I feel overwhelmed. Now I feel depressed. Now I starting to feel all these things. Now I can't comprehend what's going on. Now I'm going into like a, you know, you're kind of sinking and sinking and sinking, and 100%, it's definitely a risk factor. She's really upset. Maybe I'll go get her.
Okay, it would be nice to meet her. Let's see. I'll read this one. It says there's a podcast of a couple in Crown Heights who adopted and how it was not having children for a while. It's called Extra Sauce with Chaim Cohn. So I guess that goes back to our conversation about from before, when he commented. So anybody interested in that? It's called Extra Sauce with Chaim Cohn. And then this question was specifically directed for you. Do you see hyperemesis? Am I saying it right?
Hyperemesis gravidarum. Yeah, actually, what? Yes, hyperemesis gravidarum is a, sorry, I don't even know how to like, now I can't see my face. Okay, whatever, it's fine. No, like I could see me, there's just like names like covering my face.
Oh, yeah. I think you just have to kind of click towards the top, maybe? Oh, no.
Oh, yeah, that worked. You're right.
No, I don't know. I think I turned the screen around.
Hyperemesis gravidarum is it's a high-risk pregnancy complication. It's when you have nausea and vomiting, but it's not the normal nausea and vomiting. It's you literally are throwing up so much you can't keep anything down, that you sometimes, not always, sometimes you need to be admitted to the hospital. Sometimes you need to have a PICC line inserted, which is like kind of a permanent, not a permanent, but like a semi-permanent IV, so that you can get nutrition through that, because you literally can't keep down anything. That is a huge, those girls who are going through that have a lot of, they have a really, really hard time. It's very difficult for them. They do not enjoy their pregnancy at all. Forget about pregnancy glow. Forget about any of that. There's no cravings. There's no, oh, she's saying, trust me. I'm sure this person's probably been through it then. Hi, Gaby. You're sad? Oh, no, it's okay. It's okay. Yeah, I mean, every high risk pregnancy comes with a lot of mental health. There is a lot of background in mental health with each one, because they go through a lot, and they need to build a lot of coping mechanisms. Again, expectation versus reality is a huge thing for them. And then on top of that, they have to be anxious, am I going to be okay? And is my baby going to be okay? Those are always the two biggest questions that we never have answers to. We can always just say we're going to do our best. You're in a good place, and which is true. And I've seen lots of incredible things happen for these people. Thank God, modern day medicine is amazing, and we're very lucky to have it. We've saved tons and tons of people, tons and tons of babies, and yeah. So yes, hyperemesis gravidarum is it's a rough one. I do not envy anyone who has to go through it. It's hard.
Okay. Well, I don't see any more questions, and we can just wrap it up now because the time's almost up. So,
okay.
Unless you had something specifically you wanted to talk about.
Nothing in particular. I think we've discussed a lot of the things that essentially I see and I have experience with. You want to say hi? She was crying. She's a little bit snotty.
Oh, hi.
Hi. Yeah, I think maybe I just want to wrap up with maybe my sister and I were also talking about this with kind of do's and don'ts of pregnancy, postpartum mental health. And again, it's not even a mental illness necessarily that you're coming into pregnancy or postpartum with. It's just realizing that sorry, she has a little bit of a cold. Did you just spit up? It's just realizing that these things can happen. Realizing when you need to get support. One of the things we always educate partners with before they leave the hospitals, we always tell the woman, okay, look for golf ball size clots, look for bleeding this, look for, with breastfeeding, with pain, with baby, jaundice. We're telling them a million things. We always turn to the partner, so the dad, or if maybe their mom is there or whatever it is, we always look at the partner and we always say, if your wife is ever, there's a sudden change in mood, or she's suddenly not really interested in the baby, or she's talking about, she's feeling very down about herself. She's not feeling like a very good mom, talk to her, see what's going on, but definitely seek help on her behalf. Bring her to a doctor, maybe call telehealth, which is a line that we have in Canada. That's, I don't know if are you from Canada? No.
I'm not. Rebecca is.
Oh, okay, fine. It's like a telephone line that we have that you can call that there's a triage nurse on the line and she'll tell you, oh, you should seek emergency help, or oh, you can just go see your doctor tomorrow. Being so cute. Yeah, I think that definitely.
That's good. I like that they talk to the husband or the mom.
Yeah, it's something that I really I like educating the parent, the father, and that's their one thing. We're literally let the mom, the mom is gonna be worried about everything else anyways, because that's just the way she's gonna be, because she just had her baby and whatever. I'm you focus on the mom's mental health, and we don't necessarily say that direct, we also say to the mom, we're if you're suddenly feeling very down, or you're feeling you don't love your baby, or you're having a hard time connecting with your baby, don't be afraid to talk to your husband about it. Don't be afraid to bring it up to your mom. Don't be afraid to, talk to a friend about it. We do try to normalize it also before they leave the hospital. And I think that's also really important, to be educated. So I think some do's, I actually wrote them down because I was talking about it with my sister today. She's the one that wrote hi, Gabby, in the comments, Talia. So do surround yourself by a good support system, like we talked about. It's so important. It doesn't need to be your whole Instagram page or your whole Facebook friends. You know who your real friends are. You know who your people who you can really talk to, and really rely on. If that's a parent, if that's a sibling, if that's a friend, rely on them. Use them as a resource. Don't be afraid to reach out to them. Talking is so, so important. So do talk. talk, let people know, and tell them if you're going to judge me, I'm not going to talk to you. I need to speak to somebody in a non-judgmental environment where I can actually talk about my true feelings, my true, being. And don't be afraid to seek help. That's my big don't. Don't be afraid to seek help. Don't be afraid to go to your doctor. No question is a stupid question. As a nurse, I get that a lot. My patients will call me and say, oh, like, can you check my this? I'm like a little bit nervous, but I was afraid to call you because whatever. And like, I can't tell you how many times like that issue was a real issue. And I'm like so happy they called. I said, please, like, no issue is too small. No question is stupid. If you're ever nervous about anything, we know ourselves the best. If you ever feel like you're not in your place, if you're not in a good place where you were, take a step back and say, okay, like maybe I should talk to my husband about this. Maybe I should bring this up to my doctor. Maybe I should talk to my mom or my friend. The other thing is, don't be afraid to go off social media, like we were discussing. Sometimes it's good to just delete the app or delete Facebook, or you don't even have to delete your account. Just delete the app. Go off of it for a few days. See how it feels to just be in your own space where you're not comparing yourself to other people and you're not constantly seeing, all these beautiful things and all these things that look so perfect. And because you never know, right? We can always talk ourselves and say, oh, you never know what they're actually going through. It's very difficult to do that in the moment when you're looking at them and you're saying, wow, like they look perfect. Wow. Like I remember like one of the hardest things for me when I was going through it is some of these like Instagram bloggers would post their birth stories and they'd be like, there was one midwife was in the room and I pushed twice and out came my baby screaming, and like it was so beautiful. And I'm literally sitting there and I was like, there were 30 people in the room and it was a bloodbath. Like I don't even know what else to say. Like that's essentially what it was. And like it was hard for me. Like I would just be like, why didn't it happen normally? Like why was it so bad? And like, don't be afraid to go off social media. It's refreshing. It's good for your mental well-being. It's good for you to just kind of take a step back and say, you know what? I am being a good mom. I do have a good bond with my baby. Maybe our pictures are, me in my sweaty tank top and like my nursing bra and like my baby not wearing any clothes and like a wet diaper, but like those are our pictures and bless you. And they're beautiful and you don't have to compare yourself to other people. Yeah, I think that those are my do's and don'ts. And that's kind of my wrap up.
Yeah, I like that wrap up. Thank you.
Yeah, no problem.
Good takeaways. All right. Well, anyway, thank you for coming on tonight.
Oh, thank you for having me.
And thanks for your sidekick over there, Gabby. Anyway, do's and don'ts were great. Your story, thank you for sharing, and all your other tips and everything was really important for people to hear. So thank you.
Yeah, no problem. Thank you for doing this. It's really awesome. It's pages like this that make social media worth it, because you come on. No, it's true. It makes it down to earth and something like meaningful to your day, and I think that's really important. So,
thank you. Thanks for saying that. All right, and everybody who joined and who watched the whole thing, watched parts of it, thank you so much for watching, and yeah, have a good night, guys.
Have a good night.
It'll be on the live for the next 24 hours on our page, and should hopefully be on YouTube after, if that's okay.
Awesome. Yeah, sounds good.
All right. Bye. Good night.